This system is shifting, you guys, and Nebraska is doing a new thing. So they are requiring Medicaid recipients to work 80 hours a week. Now that's roughly 20 hours a week. Now this applies to able-bodied adults that's between the ages of 19 and 64 years old. Now they're not taking away their benefits, but they are requiring that they work now. Now, a lot of people have a lot of uncertainties about this program because it is new. And you know how you have a new program, how you have to work out some of the imperfections in it. And some people feel like they may not file their documents properly. And, it can be paperwork issues. People may not document correctly. The policy has not been written in stone. And people are very scared right now. Now, this is something that I want you all to think about really hard. The system is showing that they can ensure able-bodied people to work 20 hours a week so that they can get health insurance. But they can't insure working class people who are working 40 hours a week, who's working second jobs, people who's working gig work. They can't insure them because, working people, we have to meet these high deductibles. And sometimes we can't even afford prescriptions. We can't even afford to go to the emergency room. But if a person works 20 hours a week, they will be fully insured. That don't sit well with me, you guys, because why can't you make health insurance available to all working people? Can somebody answer that question for me? When systems have control over people, they will treat you any kind of way. Now, I truly feel bad for anybody that's working and who's in pain. And I know that there are some diagnoses that don't get classified as being disabled, but the pain is very real. The system is showing right now that they're not going to spend money on things that they used to in the past. So a lot of people are going to have to adjust. Nebraska is saying that if you're able-bodied, you need to be working. And I can see why they feel that way. If you're an able-bodied person, you should be working. You should be productive. But I do have another question again, like, how do they make decisions on who's truly disabled? Because we see time and time again that there's people that's going to work that has chronic illnesses. I was working with a coworker one time. She had breast cancer and she was still coming to work, and she had a drainage tube. She would go to treatment and come back, and the drainage tube would still be connected to her, and she would sit there and type. She still had to work, y'all. I told y'all about the time I went to TJ Maxx and I saw this lady. She was dragging an oxygen tank with her as she was checking people in the dressing room, but she was still doing her job. It's a lot of people that's working with chronic illnesses, mental illnesses. So I feel like if you are able-bodied, you need to work. Where's the line of separation? Because working people, we have been coming to work with all kinds of disabilities, and people still have to work. They have to accrue time so they can get their health insurance because they have to pay into the health insurance. Like my coworker, she got real sick during 2020. You all know what happened. She had the virus and she had to come back to work, and she was about to lose her health insurance. So she had to come back to work. And I seen her come through the doors, you guys, dragging that oxygen tank. She didn't even look like herself. She didn't even look like she had any life in her. She was pale. She was still recovering, but they told her she had to come back to work because she was going to lose her benefits. And after seeing that, It did something in my spirit, y'all, seeing her that way. But thank God she was able to recover. They put her on light duty. So I'm so glad they gave her grace because that was something hard to go through. So I'm going to tell you all some of the things that Nebraska states what's considered working requirements. And I'm going to pop it on the screen for you all. Working requirements include going to school or participating in apprenticeship, participating in a work program, or volunteering. So that doesn't seem too bad to me. I mean, furthering your education, maybe doing an internship. But you all know what I found that was interesting? These are the people that don't have to do the work requirements. I'm going to pop it on the screen for you all. Now, these people are exempt. They do not have to complete the work requirements. People under 26 who have aged out of foster care, people who are members of recognized Native American tribes, parents, caretakers, or guardians of children up to age 13, or of an individual with disabilities, veterans with a total disability, people who are medically fragile or have special medical needs, including blindness or disability, substance use disorder, disabling mental disorder, or someone who has significant physical or intellectual development. People compliant with work requirement under the SNAP or TANF programs, and people who are participating in drug addictions or alcoholic treatment programs. And of course, women who are pregnant are up to 12 months after the end of pregnancy. I found that very interesting if you're participating in a drug rehab program. It's not too strict. And I like that they are exempting parents with children with disabilities up to age 13, because that's a lot to be a parent and taking care of a child with disabilities. Y'all know I'm a social worker, so my spidey senses be a little different. So I'm thinking about people who have not been working because the system does not make it easy for people. So I'm thinking a lot of people are going to have a lot of problems with transportation because I looked up Nebraska and their transportation and transit system is not very good. It's kind of like Alabama. Everybody's driving to work. Their bus system is not that good. I think it stops at a certain time. So I can see that being a problem for people trying to get a job. Not impossible, but it's going to make it very difficult. What do you all think? I know it's very hard here in Alabama because we have the Max bus. That's our transit system, and it doesn't go in all locations. So if a person had a job in a certain location and the Max bus does not go into that location, that would be a big problem. And the Max bus stops at 7 o'clock. So if you're working later, that's a potential problem. So I can see a lot of things happening, a lot of kinks that they're going to have to work out. But this is the new requirements now, y'all. This is how America is going to be now. And it's going to force a lot of people to grow up. They're going to have to adjust and learn how to develop their gifts and their talents and to have some tenacity because nobody is going to give it to you. I know it's going to be hard for some people because there are some blurred lines. There are people with certain diagnoses that does not qualify for disability. So I truly feel for those people. But make sure you all drop some comments. That really helps the algorithm. Put some eyeglasses if you see what I see. And that's all I have, you guys. And I look forward to talking to you all in the comments.